Hello friends, welcome back to Lange. This lecture is on Tetralogy of Fallot. Content of the video: Introduction, Component, Etiology, Hemodynamics, Clinical Features, Physical Examination, Investigation and Management of Tetralogy of Fallot. Tetralogy of Fallot is a common cyanotic congenital heart disease. It has four classical features. They are pulmonary stenosis, malaligned VSD, right ventricular hypertrophy and overreading of aorta. These are the components of Tetralogy of Fallot: pulmonary stenosis, malaligned VSD, overriding of aorta, and right ventricular hypertrophy. The X-ray of tetralogy of patient shows boot-shaped appearance of heart. Etiology of tetralogy of Fallot. Some syndromes are associated with tetralogy of Fallot. They are Aperts anomaly, Silber's anomaly, Goldenhar syndrome, Lange syndrome. Some drugs they are taken by pregnant women means it leads to harmful to the baby. The drugs are Trimethadone and Thalidomide. Now the hemodynamics of tetralogy of Fallot. The deoxygenated blood from the right atrium passes into right ventricle. Normally, this deoxygenated blood reaches the lung through pulmonary artery. Here, pulmonary stenosis present. So, the pressure in the right ventricle is increased and the deoxygenated blood passes into left ventricle through the ventricular septal defect. And then the oxygenated blood and the deoxygenated blood mixed and reaches the systemic circulation through aorta. The pulmonary stenosis that leads to right ventricular hypertrophy and the pulmonary stenosis that leads to high pressure in the right ventricle that causes right ventricular hypertrophy. And then the deoxygenated blood passes from right side of the heart to the left side of the heart through the ventricular septal defect, that is right to left shunt. And then the deoxygenated blood and the oxygen blood mixed and circulated through the aorta. In Tetralogy of Fallot, we can hear the ejection systolic murmur. It is produced due to the blood flow from right ventricle into the pulmonary artery across pulmonary stenosis. So, it leads to ejection systolic murmur. Systole means contraction. Severe pulmonary stenosis that leads to less blood flow into the pulmonary artery and shorter the systolic murmur, and right to left shunt is increased and the cyanosis level is also increased. It is also denoted as cyanosis is directly proportional to severity of pulmonary stenosis and the systolic murmur is inversely proportional to pulmonary stenosis. Clinical features: the symptoms occur anytime after birth, anoxic spells, cyanosis, dyspnea and exercise intolerance. These are the clinical features of Tetralogy of Fallot. Anoxic spell, it is also known as paroxysmal attack of dyspnea, tet spell, cyanotic spell and anoxic spell. It occurs after waking up or after the baby starts crying. The dyspnea is present, so it leads to bluish discoloration of skin and mucous membrane, and it also leads to loss of consciousness and convulsion may occur, and the frequencies are varies from once in few days or numerous at every day. Squatting: when the patient get dyspneic, they are going to squatting position. It is to relieve the dyspnea. How? The dyspnea is due to deoxygenated blood circulated into body, right? So, if we reverse the circulation means the dyspnea may reduce. This position compresses the blood vessel in the legs. So, it leads to more pressure in the left ventricle and then it leads to slight shunt reverse. So, the more oxygen blood circulated into our body. So, this position is comfortable to the patient. Physical examination. The patient may be cyanotic, clubbing is present and heart sound lub and tap. First heart sound means lub. Second heart sound means tap. The first heart sound is normal in Tetralogy of Fallot, but the second heart sound is different. How? Normally the second heart sound has some split. The split is due to the closure of aorta and pulmonary artery. First the aorta close, then the pulmonary artery close. So it leads to some split in the second heart sound. Here the two arteries are closed at same time. So single second heart sound is produced and we can hear the ejection systolic murmur, and also we can feel the mid-parasternal impulse and systolic thrill. Investigation of Tetralogy of Fallot: chest X-ray, ECG, echo and cardiac catheterization. X-ray, I already told, the X-ray that shows boot-shaped appearance of heart in X-ray, and it shows pulmonary oligomnia, small pulmonary conus, cardiomegaly and ascending aorta diameter is larger. Tetralogy of Fallot ECG: tall R wave is present and upright T wave is present. It indicates the right ventricular hypertrophy, and we can confirm the Tetralogy of Fallot by echocardiography. Right ventricular hypertrophy, deoxygenated blood that circulated into our body, overriding of aorta and ventricular septal defect, and cardiac catheterization is also used. Treatment of Tetralogy of Fallot: first medical treatment, then palliative, corrective. In Tetralogy of Fallot, first we can manage the cyanotic spell. That means ANOXIC spell. First, give the oxygen. Knee chest position is comfortable for the patient. And then morphine and ketamines are reduce the cyanotic spells by sedation. Sodium bicarbonate used to reduce the acidosis, and hypovolemia is corrected by DNS IV fluid, and then keep the child warm. If the baby is anemic, means infuse the blood product. Beta blocker is also used to reduce the cyanotic spells, but it is contraindicated in bronchial asthma and ventricular dysfunction. And then monitor the saturation level, heart rate, blood pressure levels. Palliative procedure. The main goal of palliative procedure in Tetralogy of Fallot is increase the pulmonary blood flow. Indication of palliative procedure are neonates with Tetralogy of Fallot and pulmonary atresia, child with hypoplastic pulmonary artery, infants with hypoplastic pulmonary annulus. Age is less than 3 months, but the patient have medically unmanageable hypoxic spell, and infants weight less than 2.5 kg, abnormal coronary artery anomaly. These are the indications of palliative procedure. Palliative procedure systemic to pulmonary shunt. They are: first, central shunt. Connect the ascending aorta with mid pulmonary artery. Port shunt. It connect the descending aorta with left pulmonary artery. Watterson shunt. It connect the ascending aorta with right pulmonary artery. Modified Blalock-Taussig. It connect the subclavian artery with pulmonary artery. Classic Blalock-Taussig means connection between subclavian artery with pulmonary artery. Corrective surgical management is closure of ventricular septal defect and relief from the right ventricular outflow tract obstruction. That means pulmonary stenosis. We can use the transannular patch for the pulmonary stenosis and then close the ventricular septal with patch. Complications of Tetralogy of Fallot are dyspnea, exercise intolerance, limit the patient's activity. Each attack of anoxic spells are potentially fatal. Low oxygen carrying capacity of blood that leads to anemia. Cardiomegaly, congestive heart failure may occur, and then the patient more prone to infective endocarditis. Question time. Component of Tetralogy of Fallot are malaligned VSD, pulmonary stenosis, right ventricular hypertrophy, overriding of aorta. Thanks for watching.